going to turn this over to Adam and Mike and get started. So Mike, you should have control.
Thank you, Amy. Good day, everybody. Thanks for tuning in. I hope you find this informative and educational and maybe even a little bit fun. My name is Adam Strom, and I work out of Eide Bailey's Minneapolis office. I work as a healthcare consultant, and I do a variety of projects with clients all over the country on market studies, market analysis, strategic planning, community health needs assessment, and some other things. But the thing they all have in common are the people, the service area, the utilization, the need, the demand, and how a health system or hospital or clinic can attempt to recognize what those needs are and try and meet those needs to the best of its ability. So thanks a lot for tuning in. Now over to Mike for an introduction.
Thanks, Adam. Again, I'm Mike Milligan. I'm president of Legato Healthcare Marketing. We generally are working with rural healthcare organizations is really our focus, and that starts with marketing planning. And the marketing planning, as we'll talk about here today, certainly needs to be based on data and different kinds of data that we'll talk about. And we've formed a good relationship with Eide Bailey over the years where they've actually helped us in terms of some of the upfront analysis and such. And so what we're going to talk about today is really how, first of all, forming a strategic plan, how important that is and the components of that, but then how that ties in quite nicely to transitioning into your marketing plan. So again, thanks for joining us, and I'll turn it back over to Adam at this point. So
thanks, Mike.
You're welcome.
Yeah, this is a bit of this is our agenda for today. So these bullet points, this is what we're going to go over today. And as Mike mentioned, there's a lot of alignment between strategic planning and marketing. In my view, strategic planning is part of marketing, and conversely, marketing is part of strategic planning. Data is a big piece of the overlap or the commonality between the two. So we'll talk a lot about that. We're going to start with some scope, and by that I mean, how big of an effort do you want to put forth when you're doing strategic planning or marketing or both? We'll ask, what is strategy? And we'll talk that through a little bit. We'll talk about the people that need to be at the table and the buy-in that you will hopefully achieve throughout the process. We'll ask ourselves, who leads the strategic planning process? We'll touch briefly on your community health needs assessment. We'll talk about your mission, vision, and values, and the importance of data. And then we'll talk about some of the nuts and bolts of the strategic plan. Mike, do you want to touch on the agenda from more of a marketing focus?
Sure. And again, what we're going to talk about will build right off of that. And we'll talk about from a marketing perspective, there's going to be a market analysis, which is a lot of what Adam and his team do, and then market research, which we'll kind of talk about the difference, but how all of those are important in terms of developing your plan, getting a little bit more specifics of some reminders of how to form marketing goals and service line prioritization, those types of things. So let's get it started.
Thank you. In terms of scope, how big of an effort do you want to put forth when you're doing strategic planning? And also, how big of an effort can you put forth? So what are your resources in terms of time, energy, people, and money, and other resources? So when you decide how big of an effort you will put forward, you want to ask yourselves, what do you want and what do you need? Okay? We look at a lot of this in terms of bookends. On one side, you may have an abbreviated strategic planning effort. This really could end up with a one-page bullet list of strategic priorities. And we've done that with people, and it's been to the point, it's been effective, and it's something that the organization can refer or reflect back upon to keep them on track as they pursue the 3 or 4 or 5 specific objectives or goals that they nailed down in the process. So that's on one side. On the other side of the bookends, or on the other side of the spectrum, you may want and need a full 5 or 10-year strategic planning document. And we've done those as well. This might be a 60 or 80 or 100-page strategic plan document, and it could span over the course of months. It could involve a lot of players to gather input. It involves more summarization and report writing, and it can be really effective. And we talk about it being a very specific guidance document, complete with an action plan, with dates and accountable parties for each initiative. And so, in summary, it's a comprehensive document that I think works for a lot of organizations, especially if they haven't done a strategic plan at all or in recent times. So you may land somewhere between these two bookends. So some factors in determining scope. Again, what do you need and what do you want? But some more specific questions. Do you currently have a mission, vision, and values? And if you do, are they still effective? Are they still to the point? Are they still inspired? In other words, could they use updating? Do you have a recent strategic plan? If you did a comprehensive strategic planning effort 2 years ago, 3 years ago, you may just need an update or some revisions made to that plan. Or if it's been 5 years, 10 years, or if you've never done it, it may be time to launch a larger scale effort. And lastly, has there been some significant organizational change in recent times? Changes with your facility, with your services that you provide, with your provider levels, with the competitive landscape, or maybe some changes with your patient base or the population. So things like that might call for a closer look at your current goals and the needs of the community and whether or not you can meet some or all of these needs in some new way. Next slide, please, Mike. So really, what is strategy? And sometimes it depends on who you ask, but we really want to emphasize that it's a plan of action or policy designed to accomplish a goal, okay? And the key word there, or the key words there, are plan and policy. So we don't get specific when we think about strategy. We get specific in the process when we are designing and writing a strategic plan document, and specifically the work plan. We get very specific in how to reach the goal. But in terms of strategy, it really is a plan of action or policy designed to accomplish your goal. And what I'm getting at here is a difference between strategies and tactics. So your strategic plan should specify the mission and the exact approach in getting there, okay? So we will ultimately get specific in tactics or initiatives in meeting your goals. Next slide, please. All right, let's talk about people. Who builds this plan? Who builds this effort? And really, who owns it? And back to a bookends frame of reference. On one hand, if you're doing an abbreviated effort or an abbreviated strategic plan, this may only involve the executive team and maybe some trustee representation or your board representation, or it may just be your board. It may be a small group that can really bang it out in a session or two and stay focused. I would imagine in those instances, some of the goals are already determined to some degree. So there may not be a lot of dialogue or brainstorming or back and forth required to nail down the direction you'd like to go. On the other hand, you may have a big effort involved over the course of several months. So you may involve the community through a survey or getting community members to focus groups. You may include providers or select providers. You'll get some that are very vocal and want to contribute, and you get some that might be hands-off. You may include department managers, you may include trustees or board members, and you'll certainly include your executive team. So again, where you land may be on one end of this spectrum or the other, or somewhere in between. Big takeaway here is if you are asking leadership, staff, board members, community members, anyone, if you're asking or requiring some of those players or stakeholders to implement some of these initiatives, to take action, to be the doers, they'll be more effective in doing that if they had a seat at the table when it came time to write out or decide upon what the initiatives are. If they helped build it, they'll do a better job implementing it, and a big point here, they'll have more fun doing it. So that's the buy-in component. I can't emphasize that enough. Next slide, please. So who leads? So often what we see is it's your CEO, your administrator who's leading this, or sometimes it's the board chair. You may have someone else who's a motivated and enthusiastic individual. You may have someone with some really strong facilitation skills. You may have someone, you may be lucky enough to have a strategy or growth officer, but that's not a common position that we see at every hospital, and especially smaller rural provider organizations. So your internal options are what's listed there. Plus to also include maybe somebody from the community who could be an asset there. And you may have an external party come in, a third party come in, maybe someone neutral like a consultant, a person with some facilitation expertise, a person who is really good at getting input, but also important is to know what to do with all the input you've gathered, because that's a whole nother task. So really it depends on what you want and what you need and what your capabilities are when you're determining who will lead the process. Next slide, please. All right. Your Community Health Needs Assessment, or CHNA. You're likely more than familiar with this, but in case you're not, I'll go over it very briefly. Most tax-exempt hospitals in the US, and not all, but most, are required to complete a Community Health Needs Assessment every 3 years. It's part of Internal Revenue Code 501R3, and it was established about 9 years ago, I think, within the Affordable Care Act. It needs to include qualitative and quantitative data, and it focuses really on the health needs of the community. Now, these are enlightening efforts, usually done through a few focus groups, usually done with a community survey, and they illuminate a lot of perceived and or real health needs in the community. And Eide has done a lot of these, and in addition to learning things and getting information on the table, there's a real value in the process of doing a community health needs assessment because it brings people together at that table. And sometimes when there is a perception of a lack of resources for one or more health needs, the illuminating or the discovery that takes place at these work sessions reveal that there are more resources than people were aware of. So that's just a side note on these things. Now, why are we talking about community health needs assessments? Well, because a lot of the input that comes in is the voice of the customer or the voice of the community. And I can't think of anything more important in marketing or strategic planning as getting the voice of the customer. Now, how many times a day or week are you asked to complete a survey, whether it's someone calling you or texting you or emailing you or a pop-up on the web page that you're browsing? Many times, 1 time a week, 3 times a week, because information or data is king, especially if it's information from a customer or a potential customer. So I can't say that enough. In strategic planning and in marketing, data is paramount, and especially if it's the voice of the customer. Even more, a lot of times when you're surveying patients, they're already your patients. Now, their opinions are pretty important, but what about the opinions of people who are not your patients? Specifically, the question comes up, or I push this out all the time, why are non-patients not your patients? Maybe they had a bad experience with your organization. Maybe they don't live close enough. Maybe they're attached to a long-term provider they've had, or maybe there are some other reasons, but wouldn't you want to know? And so that really has some marketing and some strategy implications. So back to the CHNA. The CHNA really focuses on the health of the community, which is important in strategic planning. But one difference is that strategic planning really is about the health of the organization. Now, I know there's a lot of overlap there and a lot of alignment, but the two things are different, okay? So if you're able, and to the degree you're able, incorporate the findings from your CHNA into your strategic planning process. Next slide, please. Mission, vision, and values. And we touched on this, and I won't spend a lot of time on this, but a long time ago, mission and vision and values, if they existed at an organization, were long-winded. Sometimes they were half a page, okay? And I think there was some value in being, in the elaboration there, in the completeness of it. But I think sometimes they lost meaning, having too many words, and it wasn't something that anyone would memorize or know. And if you can't recite it, it's less likely you'll live it. Okay, so mission and vision values became brief in the last 5 or 10 years, and I've seen it, and they look good for the most part. So take a look at your mission and vision and values if you have them. How old is it? Is it inspired? Are they effective? Are they brief and to the point? And the main question here is, could they use a refresher? Okay, that's a really important thing to look at, whether you're strategic planning or not. Let's do a polling question here. I'll transition to Amy, who will walk you through this brief polling question.
And the question is, what is strategy? And you have a few different answers there to pick from.
All right, thanks for tuning in, or thanks for answering and sharing your opinions on that question. It's a little bit tricky. We really were going for the first one. It's a plan of action or policy designed to accomplish a goal. But I think the tricky piece was that the strategic plan itself should specify the mission and the exact approach in getting there. So I don't think I clearly delineated number one from number two there. So I think all of the above is a fair answer. However, I was really more focused on a plan or policy pieces for what strategy really is. All right, let's move on to the next page, please. Let's talk about the importance of data. And this has a lot of meaning, a lot of value, and a lot of impact when you're doing strategic planning. And in fact, if I were the leader of any kind of organization, I would have a lot of these things on my wall at all times, maybe even a living, breathing dashboard kind of thing with around like, what is our service area? Who do we serve? What's our market share? Who are our competitors? Just things like that. Data is paramount in strategic planning, and especially marketing, and Mike will really talk about that a lot too. To set the stage for strategic planning, I do what I call the data dump. And I do a lot of preliminary research on an organization's market position and relation to competitors. I really want to share with any group I'm working with when I do strategic planning, what's your current mission and vision and values? All right, we can adjust this, we can change this in the process, but really this is the current goal, right? This is what we're really all about. We go over the CHNA highlights. We share what the prioritized health needs are as identified in your last CHNA. We talk about your service area definition. And by that, I mean, where do your patients live? Who do we serve and where do your patients live? Is it 2 zip codes, 6 zip codes? Is it 1 county or a collection of 3? We should know that. We should talk about the population trends of that service area and the population projections for what's around the corner. We look at historical inpatient and outpatient volume trends. Shouldn't everyone know that, who's in a leadership position or who sits on the board? What's been happening with their volumes and what's expected to happen in the next couple of years? Competitive presence and market share. If you're lucky enough to get access to some data, if you have someone skilled, whether internally or externally, who can parse the data, sort it out, pivot, make some tables and look at the trends over time with market share, it can tell a really interesting story. So those are really important data elements that I share on the front end of a strategic planning project, and I call it just the state of the union. It gets everyone's juices flowing and really able to start thinking strategically. So the documents, thanks Mike, the documents here can be a short version of a strategic plan, right? It may be a list of goals with accompanying measures like this. The goal here, to grow our patient base by offering a comprehensive, high quality, and cost-effective array of services, right? I really encourage you, for the sake of accountability, for the sake of this all being worth your time and money, to assign a measure or two to each goal. And a measure answers the question, how do we know we're winning, or how do we know we're being effective with this? The measure in this case might be patient volumes, service line cost accounting, or a service continuum gap analysis. And these should be listed in your planning document. Next page, please. All right, the long version of a strategic plan. And again, you might fall somewhere in the middle. The long version might include all the market data revealed in that data dump I described earlier, right? Your mission and vision and values. It should contain some, or could contain some of the community input, whether you got it recently for this effort or using some from your CHNA, right? It should contain your organizational pillars or your foundational areas, if you've developed those in the planning process. There should be goals under each pillar, 1, 2, or 3. There should be objectives under each goal. There should be measurability for each objective. There should be an initiative for each objective. How, right? We're getting more and more specific. And for accountability, there should be time frame and accountable party for each initiative. Let's name names. You know, let's get people on the paper to be accountable for this. Let's see an example of how we get from general to specific. This is an example under an organization's pillar number 5, which in this case is growth, and relates well to how your marketing plan might address any kind of growth goal. So the goal in this case is on the left, to increase and enhance capabilities, services, and return on investment. Well, what is the objective? Community healthcare needs are met by our organization. You see how lofty and vague these are? That's okay, because we're going to get more specific. Now, how do we know we're successful? In the middle there, well, the gaps in local healthcare services are reduced. Number 2, we have relationships with other providers to assist in meeting these local healthcare needs, and so on. Now, getting more specific, we talk about some initiatives. How are we going to do this? Continue quarterly reports to the board on review of new service lines. Add reports to manager meetings and medical staff quarterly meetings. So those are some specifics. And on the far right, who owns this? Well, in their case, it was the COO, and the process was to be in place by the end of 2019. It's an example of how we go from general to specific. Next slide, please. Here's Amy's polling question number 2.
All right, everyone. So polling question number 2 is now open. It is a true or false. A defined measure or two for a goal can help answer the question, how will we know we're successful? Looks like voting has pretty much stopped, and we are at 100% true. So good job, everyone.
Good job, everybody. I hate to tell you though, but that's wrong. You're all wrong. I'm just kidding. You all nailed it. And it's kind of a softball question, but I'm glad you got it right. How will we know we're successful? Because we've met these measures. All right. This is an overview of what we've talked about so far, okay? Not a summary of the whole talk, because Mike has a lot to talk about in terms of data and strategy through a marketing lens. We talked about scope based on what you want and what you need. We talked about buy-in and how those expected to implement each initiative should be at the table when you're designing the initiatives. We talked about the importance of data and how we need to make each initiative actionable, okay? Get the right people at the table, assign an accountable party, and assign some completion dates, or at least dates to kick off each initiative. And lastly, we didn't touch on this, but to the degree you're able, make this process fun. Strategic planning can be hard, and it can take time, and it can be stressful. So bring chocolate, I'm serious. Bring some other food, stand up, move around, take breaks as needed, and lastly, lead with some enthusiasm. You'll get a lot done, and I hope you'll have fun doing it. Let's transition now over to Mike.
Okay, thanks so much, Adam. As we'll talk about here in just a moment, so many of the attributes and the effective ways to do strategic planning directly apply to marketing. They're just really synced up together. So what we're going to talk about here again is just kind of broad strokes a little bit, but in terms of developing a marketing plan, as we've talked about, that truly does align with that strategic plan. And some of the more successful marketing plans that are developed or that we develop are based on having a successful strategic plan. Otherwise, without the right strategic plan or without the right data, you're relying, which has some value, but you're relying on instinct and experience. But again, you want to match that with the scientific end of things in terms of making sure that we're on the right track. So we have a polling question here. So true or false, developing a marketing plan that aligns with a strong strategic plan can generate a cohesive, coordinated strategy that effectively reaches your organization's short and long-term goals.
All right, polling question number 3 is open. All right, looks like we're tracking 100% true.
That's good. All right, good job, everybody. What you're seeing here is an example. This is our thought process, and you may do things differently, but a couple things that I want to just kind of explain in terms of how the flow of things should work when you're doing your marketing planning. So a lot of the things that Adam discussed are really what we kind of describe in our stage 1 and stage 2. So there's the gathering of information, there's a gathering of data, the market analysis, which is a lot of what Adam talked about today. It includes the competitive analysis. And then under stage 2, it's really, absorbing that information, applying that information, determining, for instance, if we do need primary research, and then moving into service line prioritization. I'm going to talk about a few of those things here in a little bit of detail. But the point being that, it makes logical sense, but we have to have the data, we have to do the thinking before we get to the actual marketing plan, which is what we call here the treatment plan. And as I'll mention in a moment here, but just in line with what Adam was talking about, these objectives need to be very specific, and we'll talk about different ways in which you can form those goals. And then the last part is the actual implementation or the tactical part of things after we get through the strategy. So where do we start? Data. I think that's a common message here, right? We kind of start with data. So. Okay. So, data, the way that we describe it is there's market analysis and there's market research. They're not necessarily mutually exclusive, as Adam talked about. A lot of times there's market research. It's part of maybe when we're doing market analysis as an example. But I just want to emphasize here, the market analysis is, in many ways, it's forecasting changes in utilization in order to be able to look at the future. So it's really, what Adam kind of talked about is that state of the union, but it's also not just looking at where we are right now, but it's based on a number of data points of where we think we're going to be, what are we going to forecast, because as you can imagine, that dictates so much, what we're going to do. So I'd look at it and say market analysis is kind of like, what are we going to market? And as we'll talk about in a second, market research in itself might talk more about how we're going to do it or what the messages are going to be. So when we look at market analysis, and Adam, feel free to chime in here anywhere here, but what we're looking at is we're assessing a number of data points, and Adam hit on some of these already, but we're looking at, obviously the existing patient base, but we're looking at projections in terms of demographics and where we're going to grow, by how much. And we also, as we'll show here in a second, there's a delineation that we might make about what's anticipated for a growth in a 5 or a 10-year period in maybe in a certain service line, what have you. If you were to do nothing, in other words, if you were to not add a new project or you were not going to do any marketing, what is that forecast? And then there's a different analysis of, okay, if you were to do something, where are you going to go? As Adam mentioned as well, obviously having a real keen sense of the competition. And again, just looking for opportunities. And opportunities might mean that we're capitalizing on a weakness of a competitor too. That might be part of your strategy. So part of that, of course, is, we have it defining a primary service area. It also might be, and I'll show an example of defining a secondary service area. Just as a beginning stage, there's lots of other components of this, but the research process is looking at population, age, income, a lot of other demographic information. So partly, what is used for that analysis is accessing the advisory board. And there's a lot of information there, and we'll kind of show you some examples of that, but it's based on, zip code specific market data. And as we've talked about, we're looking at inpatient, we're looking at outpatient data, we're looking at what volumes we're going to be projecting, and we're looking at the competitive presence as well. Adam, is there anything you wanted to add to this part in terms of?
Yeah, just on the advisory board and what it is. It's a whole another hour we could talk about advisory board, but it's all things healthcare, and it's a deep healthcare resource.
Mm-hmm.
And one of the things I use it for are the analytics tools.
Mm-hmm.
And Mike will show you a little bit more about that in a minute. But they do a really good job of making some projections for healthcare utilization specific for any geography. So you can custom tailor it to what you've determined to be your service area or your patient base.
So again, when we look at those deliverables, some of the measurements, market share overall, maybe market saturation, growth capacity, and again, competition. So to give you an example here of what Adam and I have been talking about, if you can see this okay on your screen, this is an example, but you can see here where we talk about, you can see here in the column, we have a 2018 volume estimate, 2023, 2028. And to the right is kind of what I mentioned before. This is, growth, maybe 5-year, 10-year growth, what's expected in these particular areas. So as you look at this briefly, for instance, you might look and say, you look at orthopedics and gastroenterology at the bottom, and you're looking in which obviously are huge money makers. Now, as you might imagine, these are also maybe dictate what you're going to do in terms of physician recruitment as well. It's not always just marketing, but it's as you're looking at your future growth and what you're able to do. But you can see here, obviously some substantial differences in, 39% opportunity of growth in 10 years. So that's kind of a head scratcher. So obviously it's not always easy, in particular for rural hospitals, to recruit some of these specialties, but it gives you an idea of, where to focus some things. So, and we use that same analysis as we look at procedures as well. And just as a side note, a skill or a tactic that we often use in marketing is, although our goal is to grow a specific service line, the strategy is really to market a condition. So in other words, we're marketing colonoscopies, or we're marketing, a heartburn clinic, or, knee problems, or whatever it might be, that ultimately though are focused on increasing volumes in certain procedures. So again, I won't go through all the details here, but you can just see the same type of analogy that's used. So this is where, as we're using that data from a strategic plan to apply to a marketing plan, it helps us to make priorities in terms of what we're going to market, what we're not going to market. Of course, that is balanced with what is actually we're able to do, what kind of equipment do we have, are we able to actually deliver on that product? And so the point I'm making there is that even though you see this, everything isn't necessarily market ready. This is kind of showing you that there's some opportunities. You may or may not be ready to market that yet, but at least it helps you to kind of position for the future. Same idea here, and this is kind of overall volume projections. It just shows you, again, these are just representative samples, but kind of shows you, the opportunities. And what I was referring to earlier when I kind of talked about it to the far right on this chart about the no project change or a project change or some sort of, and so that's where you can kind of see that difference. Do you want to elaborate at all on that one, Adam, in terms of
Yeah, you just have a few different inpatient and outpatient services here.
Right.
And the projections can be, like Mike mentioned earlier, if nothing changes, if we do nothing, what might the population implications be for utilization of these services, right?
Right.
Or if we initiate some sort of project or combination of projects, whether that's a new ED or a new facility altogether, different providers, some enhanced marketing effort. So what might that, or what impacts might those efforts bring? And the column to the right, the far right, says this is the project change, and this is the 5-year trend, as opposed to a no project change.
Absolutely. Thank you, Adam. So as I mentioned, a lot of what we've discussed here is the market analysis. Again, they're not mutually exclusive, but when I look at marketing research, it's really about more specifically about the how we're going to market. We've talked about what we're going to market with this, but now it's how we're going to do that. And the how can be anything from understanding perceptions of patients, understanding what awareness or what preference they have in your products or in your services, and that helps to tailor our message and actually even tailor our strategy in terms of who we might be reaching for what message or what demographic. So I'll give you a few highlights of that. So again, when we look at consumer research, again, allows you to gain the information just like the market analysis. But here again, we're identifying more preferences and perceptions of that either prospective or existing patients have of our services, and points of differences with your competition. It does allow us oftentimes to explore more about that patient experience that we know is so critical. As a side note, I also mentioned that, Adam was discussing, community health needs assessments, and with some clients, we've actually been able to, because as you can see, part of the requirement for a CHNA is having quantitative data as well. And we've been able to sometimes combine those efforts or add to the CHA in a little bit in order to gain some information in terms of perception data and those types of things. So there's the possibility of doing that. But anyway, other advantages, of course, understanding awareness, but really measuring out migration, where, we have the data to show that, but in terms of perceptions of why people are maybe preferring to go to a competitive hospital and what those reasons are, just to gain some more insight. And again, developing kind of their top priorities. So as we're all aware, there's different types of research. There's the quantitative and there's the qualitative. Generally, for what we're talking about, I'm a firm believer in quantitative research. What we're doing there is it's more scientific. We're actually able to measure, with the degree of reliability in terms of what those actual perceptions are, and it again gains a lot of insights for us. But qualitative data is important too. I generally look at qualitative data in the healthcare arena as maybe focusing on a particular area. So let's say, for instance, that your survey came back and it said that you had a high awareness of gynecological services, but you had a low preference for it. And so you'd say, so a lot of people are aware of it, but they're not going there. Why is that? Well, we still want to do some cross tabs a little bit, look into more detail of whatever was in the quantitative survey, but it might say, let's dig a little deeper. Let's do some focus groups of women of different categories. Let's try to learn a little bit more insight. Let's try to validate maybe some of the things that were brought up. Maybe there's some new learnings that we can have. So to me, I look at qualitative as more of kind of digging into a particular area. Those can be done in, as we've talked about, traditional focus groups or one-on-one interviews. I also look at, if you're not as an organization already doing community advisory groups and those types of things, they have a purpose, but part of that purpose can be actually to just gain insights of perceptions from the community. So to give you an example, so what you're seeing here, and this is just a representative sample, I'm providing the data more just to see how it's used. So what you're seeing here is, this is actually of a secondary service area. And you can kind of see how we look and we trend the data from market research to market research, and it kind of shows a difference. And so we kind of use that analysis to, to see how we're doing, but also to measure our goals. But then this is there's a preference score. And so why would you prefer to go to a particular organization over another? And then there's different attributes here that you can see in terms of better care, whatever it might be, location, et cetera, et cetera. So there's a lot of data to be able to cross-tab and analyze. The thing that I want to mention here is that, you know, we've talked about awareness and preference. So even in the example that I mentioned with gynecology example or whatever it might be, a lot of people could be aware of a service, but they're not going there. And that really is the center point for marketing, because oftentimes marketing, yes, is going to help increase awareness. But if for some reason people are not going to, even though you're aware, then we have to say, why is that? Maybe based on market research, there's some operational things that need to improve. Or from a marketing standpoint, maybe there's some better messaging or better strategies that we need to have in terms of making people really, why would they prefer? What are the attributes? You know, and that comes into who we're targeting, what our messages might be, and all of those sort of things to increase their likelihood to use your organization. So really in line with what Adam was talking about before, as we look at marketing goals, again, measurable, specific, tangible types of things, and just at a real macro level, when we look at developing goals, either business goals or communication goals. So the business goals can be some of the things that Adam talked about, you know, patient volume, scheduled procedures, those types of things. And you know, my recommendation here though is this is where you get as specific as possible, and it might be within a primary, secondary, or a secondary service area. But as an example, kind of going back to that awareness preference thing, you might have a marketing goal that says we're going to increase the preference of orthopedic services from 38 to 44% in our secondary service area by this date. Okay. If you have that sort of a specific goal, then you can really think about your mindset in terms of a marketing plan of what you're going to focus on, and maybe sometimes what you're not going to focus on, so you don't get too distracted with all of the other, you know, challenges that come up. And the communication goals, you know, they're more maybe process goals, but they might be about, we want to have a number of hits to our website or social media engagement or whatever it might be. But there's a lot of ways that there's some analytics that we can use to measure our successes. So just, you know, in general here, I want to need to get through this so we have enough time if there are questions. But those goals, I mentioned that one example, but they could be formed in so many different ways in terms of volume, market share, revenue, geography, payer mix. And again, I would just say that, you know, to be as specific as possible so that we can define whether or not we're successful. And if we're not successful, why weren't we successful? What can we learn to use as a management tool? So I kind of gave you an example, but this is, you know, again, it might be about reducing out-migration. And then as Adam talked about, there are strategies that are kind of explain how we're going to do it, but the strategies don't necessarily get into the real specific tactics. So part of when we develop a marketing plan, and when they suggest that you do when you're developing your marketing plan, is that we're basing goals off of how we might rank a particular area or a service line. And what we generally do with our clients is we're measuring a number of different criteria, and you can see these criteria here, in terms of determining what warrants a marketing resources and what doesn't, okay? And you can get very sophisticated in this in terms of weighing these options and what's more important for you as an organization than others. Because if you look at these criteria, you might say, yeah, they're all important, but I think if you have a weighting system where you're ranking these and what are your most important ones, it helps you to form goals. So as an example, if you're in a community where maybe you had a public relations image and you really need to overcome that, you're going to weight the image and the community goodwill maybe a little higher than some of the areas. On the other hand, you know, maybe you're in good shape there and you're looking at, you know, obviously profitability is always there. It's going to be a top one. But anyway, it gives you some idea, and we rank those in order to form our marketing goals. And by that ranking, put those into specific tiers. And the idea behind this is that you do a finite amount of things and you do them very well. So, and in other words, you can't be everything to everyone, certainly based on limited budgets, those types of things. So the idea is that this is, you can change this in some way, but that if something is in a tier 1, it means that 60% of all of your resources, time and money and everything are in that tier, and consequently to tier 2 and tier 3. Now, incidentally, that doesn't mean that all of your service lines are distributed equally. You may, for an example, in our general recommendations, only have like a maximum of five key areas in tier 1, and you might have 10 in tier 2 and 20 in tier 3, and you can kind of see the philosophy or the logic behind that in terms of how the math works, that how you're going to, so it might mean if something's in a tier 1, it's going to be a really focused effort. Maybe it's going to be a broader marketing campaign or something like that. And if it's in tier 3, maybe it's going to be more internal communications. So, so just to kind of wrap this up then a little bit so we have time for questions. So whether or not it's for your strategic plan or it's for your marketing plan, of course, using data-driven decisions, we've talked about the importance of that is really having that basis to make logical, decisions and analysis, and instead of kind of shooting by the hip. That market analysis in your strategic planning and in your marketing planning is just critical in terms of forecasting changes. Market research that we talked about kind of builds on that, allowing you to identify consumer preferences. And of course, as we've talked about throughout this, is why we're presenting together, is the importance of aligning your marketing plan and your strategic plan. And ideally, if you're going to have a marketing plan, that you do have a strategic plan. Even if you don't have a strategic plan, I guess at the very least is to make sure that we're going through that market analysis is critical in order to have, an effective marketing plan. So with that, we're happy to entertain any questions that you might have. Oh, and I think you have another polling question, don't we? So we'll do that one first, and we'll do questions. So the question is, true or false, data-driven decisions allow you to market to patients as individuals, making your brand more authentic.
All right, that last poll is now open. If you guys do have any questions, please feel free to use the Q&A box or the chat feature. I don't see any questions in there right now.
We were just so thorough.
You were.
So if anyone has questions, certainly can reach Adam or me if any questions or any more specifics. In a webinar, you're kind of going through it at a pretty broad level, but if there are certain questions you have about wanting to get deeper, you can certainly reach out to us. So
I did see a question in the Q&A about if the slides will be available to the viewers. Amy, do we have an answer on that?
Yep, I did answer that. So they were in the 1-hour Zoom email. So.
Okay, well, thank you so much for joining us, everyone, and taking the time out of your busy schedules to be part of this.
One real quick, my hospital just finished its strategic plan and community health assessment. Wait, how do I create my plan? Well, if you just finished your strategic plan and community health needs assessments, if they're done, I'm not sure where you'd go with that, unless you would think about maybe amending or updating or using one for the other, maybe incorporating some of the voices of the community or perceived community health needs from your CHNA back into your strategic plan. How do I create my plan? I would cross-reference them. I would go through and see if there were any health needs of the community identified. Marketing plan. Okay. So the question is, we just finished our strategic plan and community health needs assessment. How do I create my marketing plan? It might be a broad question, but Mike, maybe you can add a sentence or two around that.
Yeah. So again, there's a broader process that can happen in terms of, analyzing the data and all of that. But if you have your strategic plan, that really is the guide. So it's actually going through and determining how your marketing plan can support that strategic plan. So as an example, I would assume that in your in your marketing plan, most likely there's a section under growth, okay? So as we look at growth, we probably have identified various service areas that we want to grow. That certainly is going to align, and we want to get some specific objectives there. There may be other things in your marketing plan that maybe aren't under growth. For instance, oftentimes marketing can impact the culture of an organization, or maybe there are goals around patient experience and those types of things. So my shorter answer is use that strategic plan as your basis for the marketing plan. But the first step in there is to then, base some priorities, as I kind of talked about in this presentation. Try not to do everything, or try to, if you can extend that time period, whatever your duration is, but choose a few things that you can really excel in and do well, and then build off of those. And whoever asked it, if you have other questions on that, feel free to reach out to me. I don't know if we're providing the contact information here, but I'm sure you could. Oh, here it is right here. I'm sorry, we did have it here. So if you have particular questions for Adam or me, feel free to reach out to us as well.
And a question here from Teresa. Mike, is marketing healthcare consulting in your wheelhouse? Well, I'll go out on a limb and say absolutely. So maybe the two of you can connect
Sure.
afterwards.
Sounds good. Sounds good.
From Matt, I'm seeing, do you have examples of questions to ask community members about your services? Yes, sometimes we'll, in a strategic planning or a CHNA effort, we'll list a few services, 5, 10, or sometimes all of them, whether it's mostly outpatient services, and we'll on a scale chart, like a 0 to 10 or 0 to 5, how satisfied with are you about the care you've got in this area? And that's not a required question when doing your CHNA. However, we've done it as part of a CHNA survey to really capitalize on, or to use the opportunity the CHNA process presents, and to learn what the community perceptions of your services or your care are.
Just to add to that, that's kind of the example I was using, where you can sometimes form a hybrid. You have to be careful about not getting too carried away, so that your survey isn't too long, and thus affecting the effectiveness of it. But we have been able to kind of combine the two, maybe having additional 5 questions or whatever that maybe are going to get at some of those perception issues. If you're going to get a little bit deeper into some of those things, then you probably need to do a separate quantitative study outside of the community health needs assessment.
You bet. Let me add one more comment to that one.
Mm-hmm.
Have you asked non-patients why they are not your patients? So to your question, Matt, and I appreciate this question, I really suggest in whatever forum, whether it's your CHNA or your strategic planning focus groups, whatever forum you're using, ask, if you're not using our primary care or our services for primary care, why is it? Mm-hmm. You could give them a multiple choice: too far, long relationship with other provider, bad prior experience, etc. You can do the same thing with other specialty services or outreach. But yeah, ask non-patients why they're not patients, and it will reveal really valuable information.
In my example, it could be location. It could be patient experience overall. It could be your billing process. It could be, perceptions of quality. Could be a number of different factors.
Absolutely. These are excellent questions. Thanks for sharing those with us. Anything else? Any other questions? I'm not seeing the screen, so the comments. Okay. Yep. No more than I am seeing.
Okay.
All right, looks good. So we want to thank everyone so much for attending, and thank you to our presenters, and we hope everyone has a great day.
Okay. Thank you, everyone. Appreciate it.
Bye-bye.